When asked about the cost of a robotic hair transplant versus a human hair transplant, in our practice, the pricing of the hair transplants performed by the robots are slightly less expensive. And this is because if my hands are freed up to perform other things, obviously I'm not having to do it myself. In that situation, it can be slightly less expensive to undergo a robotic hair transplant. Another question that comes up is the robotic follicular unit extraction technique painful? In our practice, we give our patients anesthesia given by mouth, which is a combination of a benzodiazepine and a narcotic, along with a steroid to avoid swelling. And this provides the patient with a very smooth sailing experience. We're also using a mix of lidocaine and marcaine for a regional block during the recipient sites and along with the donor area before we start to harvest those grafts. Is robotic FUE faster than the traditional FUE hair transplantation? It depends. It depends on which human model you are comparing it to. For some of those patients, those providers who would be just starting out in their learning curve, the simple answer is yes, the robot is much faster and much more accurate. However, for some of us who do a fair amount of follicular unit extraction techniques, the robot's really used more as an adjunct to participate in the harvesting of those follicles and allows us to participate in other aspects of the preparation for the other types of things that we'll be doing with that same patient. Now, another issue that surrounds not only robotic hair transplants, but in general, it sort of surrounds the entire both follicular unit extraction and the strip is, what do the scars look like? And is the robot creating either more scarring? And the simple answer to that is absolutely not. There are small areas of hypopigmented skin in the back of the scalp, approximately about 0.8 millimeters or even smaller because of the contraction of these areas. It's sort of a normal process of wound healing. And so if the grafts are taken too close together, then you can get some thinned out or moth-eaten appearances in the back. That's very easily avoided by decreasing the number of grafts that you're taking in that area, or to go back through those areas and sort of thin those areas out in a subsequent procedure. When also asked if the actual robot does the entire procedure, the answer to that question is it does not. It only plays a small role in the donor harvesting of the grafts. In fact, the current prototype requires manual extraction followed by recipient site making and reimplantation of these grafts, all which is done by myself and my staff. When asked if there are multiple devices for robot hair transplants or different model numbers or different manufacturers, the quick answer to that is at the current time there is only one, and that is the ARTAS or ARTAS system that's been manufactured by the Restoration Robotics company. So again, what is the difference between a robot follicular unit extraction technique and how's that compared to the NeoGraft device? And the NeoGraft device is an old device that has sort of recently has experienced a new breadth of marketing. It's a mechanical device that uses a pneumatic tool with a pressure system and some tubing that sort of extracts the grafts. This is done with a sharp needle, and this can really affords itself to a much higher rate of transection than the robot device, especially in the novice or in the new hair transplant surgeon's hands. The robot's greatest advantages are that in a simple 1 hour or 2 hour training course, that individual can provide, with the help of the robot, transection rates that's as low as someone who is using a mechanical device and who has 15 years plus experience with follicular unit extraction techniques.